So yes, the floor is open. Let's shoot with our question if you have any, and then let's dissect them.
Please, I need a clarification with the BCG vaccine and then the tuberculin.
The Mantos test?
Yeah.
Okay. Let's go for it. I'm coming. Let me just get to the question, then we'll look at it together, okay? Keep. Good. If I'm correct, we are looking out for what? B, is it vaccine? Tuberculin.
Tuberculin, yeah.
So the question is what?
Tuberculosis.
Acute tuberculosis process.
Yeah.
Question number 6.
This is a question, right?
Yeah.
Good. So what's your question now?
Clarification with the BCG vaccine and then the tuberculin.
Okay. So the difference between the BCG vaccine and the tuberculin. Good. Now, let me not get you guys confused. Okay. A minute. Okay. Just a second, I'm coming. Okay, good. So now we have a child, a 6-year-old child who was suspected of having a tuberculosis, active tuberculosis. Process has undergone a Mantox test. What immunological preparation was injected? Guys, look at it. Now, when we talk about BCG vaccine, a BCG vaccine, like the name implies, is a vaccine. It is used to prevent a disease. Tuberculin is a test to check for the presence of the disease. Ben, are you with me? So in tuberculin is the test that you are going to use to identify that there's a tuberculosis or not. But to prevent a tuberculosis, you use the BCG. So BCG is a vaccine to prevent child from developing tuberculosis. Hope it's clear now.
Yes, sir.
Awesome.
Thank you very much.
You are welcome, Ben. All right. So who should I go to? Esther.
Yes, sir.
Good. Question, shoot.
I didn't really get the explanation of the other question about bilirubin. 16-year-old.
Okay. Yeah. I think it has to do with unconjugated. This one, right?
Yes, sir.
Good. So now let's do some discussion. Good. Now, good. So now that is it. We have 3 types of jaundice, okay? So we have this first group of jaundice. Second, I don't want this. Good. Great. So we have first group of jaundice, second group of jaundice, and then the third group of what? Third group of what? Jaundice. So just do here J1, J2, and then J3. Good. Now, you must understand that when we talk about conjugation takes place in the liver. So this over here is a liver thing. Okay? So J2 has to do with what? With the liver. Now, J1 has to do what? Before going to the liver. So, pre-liver. That means before the liver. This is liver. This one is what? After the liver. Please, are you all okay? I need responses. Are you all okay?
Yes, please.
Good, 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 good. So now, before the liver, now inside your red blood cells, okay, inside your red blood cells, you know it contains a lot of hemoglobin and iron and other kind of things. Now, if you break down RBC, it releases a substance called bilirubin. Every red blood cell that is broken down will release a substance called what? Bilirubin. Okay. Now, when the bilirubin comes out, okay, you now ask yourself, is now every bilirubin, it can be. Now, bilirubin can be, if the bilirubin has passed through the liver, we call it conjugated. If it hasn't passed through the liver, we call it what? Unconjugated. No, let me be more. You are all medical students, so let me be more medical. When a substance undergo glucuronidation, that's a process. Okay, let me look for the right word for you. Conjugation of liver. Sorry. Look for the right word for you. Good. So it can go to a process called what? Glucuronidation. That's the right word. It's a very long word. GL. Okay. Let me write this here. Guys, sorry. I want you to understand it very well so that you don't go and confuse yourself. Glucuronidation. This is the right word. Glucuronidation. Good. Now I believe you are clear on that now. Good. So this is the process, and this process can only take place inside the liver. I repeat, it can only take place inside the liver. And that's why there's this enzyme called the UDPGT. That's uridyl diphosphoglucuronic transferase, whatever they call it. That is the enzyme that is used to go to what? Conjugation. So, and I said, that place takes place in the liver. Now, before the red blood cells enters the liver and it breaks down, it will release a lot of what? Unconjugated, because it has not even gone through the liver yet. And unconjugated is also called indirect. So in some questions or in some books, you will see indirect bilirubin. It's the same thing as unconjugated bilirubin. Now, when the red blood cells have passed through the liver to some extent, don't forget, of course, not all red blood cells that pass through the liver will undergo this process, isn't it? So over here, the jaundice here, you will see some part being direct and some part being indirect. So some will be conjugated, some will be what? Unconjugated, isn't it? But more, or they are in equal proportion. Now, when we come to after the liver, after the liver, more of the bilirubin would have been conjugated. So the direct conjugation will be more than the indirect, or conjugated will be more than unconjugated bilirubin. Okay, so this is what we do to help us know if there is red blood cells damage, if there is a problem with the liver, if there is a problem with the release of whatever it is, the red blood cells, whatever it is. This is what we do to help us with the differentiation. Okay, so basically this is, so over here, an example is hemolysis, where red blood cells is being destroyed. It can be destroyed by itself, hemolysis or hemolysis. Hemolysis. Over here, when we have hepatitis or any any liver problems. Over here, when we have, a problem with cholecystitis or gallstones. Gallstones. Good. So, Esther, I don't know if I'm making sense in all of these things.
Yes, sir. Now it's crystal clear.
Good. All right, that's great. Okay, so I'll call on Ahmed. Is there any question? This is your first time, but let me hear from you. Is this something that is good, that you think might be beneficial? And if you have any question, let me hear you. This goes to Ahmed.
Yes, sir.
Good.
So everything was good, but I have one question.
Sure.
About where is it? Yes, about the toxigenic properties of the questions. The answer was the determinant of toxigenic properties.
Sure.
It's like the keywords that we should take.
Okay.
It's the diphtheria or what?
I'm coming. So so you need to know the causative agent of diphtheria.
Yeah, this one.
You need to know the causative agent of
Yeah.
diphtheria. Good. And the causative agent of diphtheria, like I said earlier on, is what? Corynebacterium. Corynebacterium.
Okay.
Let me write it for you. So if you know the causative agent, you don't have any problem. Coryne.
Bacterium, yes.
Yes. Bacterium.
Yeah.
So this function by releasing toxins. So we have to study what? The toxigenic.
Okay, yeah.
So the question is, what's the mechanism? What's the mechanism?
So the causative agent of diphtheria makes the toxin.
Yes.
Okay.
Good. Are we good? So
Yes,
don't know how it happened.
Yes.
So you can draw a conclusion on your diagnosis because already they said it is there. But what is the mechanism of action? They want to know how it's functioning.
Yes.
Good. But apart from that, presentation, okay. Everything is good.
Very good.
Good. So I go to Adebayo.
Yes, I'm here. I don't have questions. I don't have questions.
Okay. Good. I'll go to O2.
Hello.
Yeah.
So please, I have a question, but I think we didn't actually go through it today.
Yeah.
But when I was going through the videos, yeah.
Okay.
I think I even posted it. Yeah. Can I read it out?
Okay, you read it out.
Okay, so it says a patient takes digoxin for treatment of cardiac insufficiency. Yeah. What diuretic may increase digoxin toxicity due to the intensified excretion of potassium ions? And then the answer was hydrochlorothiazide.
Yes.
Yeah, but there was also spironolactone. I was asking why you didn't choose that one.
Do you know the meaning of spironolactone? Spironolactone is potassium sparing.
Yeah,
that means it doesn't allow potassium to go out. It spares potassium. So potassium will be increased. So this one will lead to what? Hyperkalemia.
Okay.
To lead to hyperkalemia. That means it spares the potassium.
Mm-hmm.
It spares the potassium. Okay. But the question is, potassium is going out.
Yeah. Okay.
So it's a diuretic that is causing it.
Okay.
Yeah.
Okay. Thank you very much.
You're welcome.
That's all. Yeah.
Great. But apart from that, presentation is okay for you, right?
Yes, please.
Good.
Thank you.
Good. Emmanuel.
Yeah, so everything is okay.
Great. Fafa.
Yes, please.
Any question?
No question, but initially I was having issues with my network. So the first two questions I didn't really get explanation.
Oh, don't worry. I'll still post the video so you can still watch it, okay? All right. Dr. Joy.
Dr. BAHA,
Yes, talk to me. How was the presentation?
it was good.
Great, great. Any question for me?
No.
Good. Steph, you are the same as Fafa, right?
Yeah, I was having an issue with my device, but I logged in with another
Okay,
device.
that's fine. Taha.
Yes, sir.
Yes, shoot. How was it?
Actually, everything was good, but I have questions, sir.
Sure, please bring them out.
Okay. So I'm confusing between sympathetic and parasympathetic.
Okay, when we say sympathetic is more or less like something that is going to make you do something like you have it of something called the flight and how do you call it? Fright and fight reaction.
Yeah.
Good. So everything of your body begins to do things in a hasty way. Your heart is beating like serious. You are running like a horse. You are doing things like crazy. These are sympathetic. Yeah. Now, in parasympathetic is the exact opposite. Your heart is pumping so slowly. Your movement is so dull. I mean, you are not doing anything active, and so that is it. So it's the opposite. Do you get me? You are sluggish. Yes. So that's between sympathetic and parasympathetic.
Okay, and but between unconditioned and yeah.
Good. Now, when we say condition means that something that you have planned to do. You have planned to do something. That's what conditioned. Now, unconditioned means that it is not planned. It was involuntary. It just happened.
Okay, sir.
You didn't plan. You just taken by surprise. You didn't plan anything. It just, see, here am I. How come? That is what? Not planned. Good.
Thank you, sir. Thank you so much.
You are welcome.
Excuse me, please. I have a question.
Sure.
Yeah. So meaning that with the unplanned ones, there will always be unconditioned parasympathetic, right?
Come again with the planned ones.
The unplanned.
The unplanned one. What?
Unconditioned parasympathetic.
With the unplanned one.
Yeah.
Good. It can, but don't forget they can also be unconditioned sympathetic.
Yes.
Yes. So it's both ways. It can be both unconditioned sympathetic and unconditioned, but it can be. It depends on the condition, but it can be. But you are absolutely right as well.
Okay, so that means when it's unconditioned sympathetic, that means there's going to be an unplanned situation and then a planned one as well.
Can you give me an example? Just right now, give me an example. You've just mentioned it. Give me an example.
Okay, so like the unplanned situation, like I think the flight thing you were talking about.
Thank you.
And then
please. I'll buy you yogurt.
I'll buy you yogurt.
But you won't see me, so yogurt is gone. You won't see me, but I'll buy you yogurt. So I bought yogurt.
You can change it to something else.
No, but you see, if you understand it, it helps you. It helps you.
Yeah.
Do you get me? It helps you. So it's great. So this unconditioned sympathetic.
Okay.
Good. Very good. I love the way your understanding is coming. So it's good. Dr. Tolu.
Right. Thank you.
Dr. Tolu.
Yes, sir.
How are you?
I'm fine, sir. Good evening,
awesome. Awesome. Are you enjoying what we're having here? Over here, we're always fighting, no?
Yes, sir, I'm enjoying it.
Great. Any question?
Yes, concerning your unplanned and your unconditioned and your conditioned parasympathetic, I have a question.
Please shoot.
It's a Krok question. It's not in this year though, but it's like in a random here. Concerning a guy that is in a fighting ring, and then he was being punched. He planned to be in the fighting ring, yes?
Yeah.
So he
didn't anticipate the punching.
or he didn't anticipate the punching, making it unconditional. Okay.
You see, it's so sweet.
Yeah.
Yeah, it's so sweet. Medicine is good. Medicine is good, my dear. Medicine is good. All right, no problem. No problem. So I believe everybody has spoken. Yes, Ben, your hand is up.
Sir, can you please go over the mechanism of the phosphatidylcholine?
Okay, now what I'm saying is this. You know, every cell membrane is made up of a bilipid layer. True or false?
True.
Okay, yeah. Every membrane is made up of a bilipid layer. Now, this lipid layer are made up of what? Phosphates. Or let me say, yeah, phospholipase. That's the right word.
Yeah.
Phospholipase. Now, don't forget, if I say bilipid layer, I should tell you that they are what? Fat tissues or fat substances. Okay. Now, what happens is that choline, okay, is always needed, okay, to prevent the cells from breaking down, because when they break down, definitely they will release their substances. True or false?
True.
Exactly. So if this choline is not present, it means that the integrity of the membrane becomes compromised. And when it becomes compromised, what happens? They begin to release their substances and they begin to cause trouble that we don't like. So from the question, what it means is that the reason or the mechanism for which we are having a fatty liver, I think that it was about hepatic steatosis. So a fatty liver is because of inadequate supply or inadequate amount of the choline. But of course, which part of choline? Choline has to do with the phosphate. So phospholipase. So phosphatidylcholine. Yeah. I hope you're okay now.
Oh, yeah, sure.
Fantastic.
Thank you very much.
Great.
No question, sir. But there's something that you said about. You said what is your sickle cell? Can you please elaborate about that?
About sickle cell?
Yes.
Good. So we said we have to call genotype. Genotype is the exact alleles that are present. You guys want my microbiology to start coming out. We have to call what? Alleles. Okay. Let me just go back a little bit and check something for you. All right. I just want to clear my screen. Good. We have to call what? Alleles. Okay. Alleles. So SS means you are what? Sickle. Okay. Then if you have AS, these are alleles. Okay. If you have AS, you are just a carrier. But normal people are AA. Are AA. These are normal people. And these are genotypes. So now in a phenotype, this person will have signs and symptoms of a sickle cell. So we can say this person is what? A sickle cell. Okay. Now in phenotype, this person is considered normal. And this person is considered normal. So you see the difference between genotype and phenotype. But always, if you're going to marry, we have to look at your wife's own. Okay, if your wife is also a carrier, there could be a problem in your unborn children when they finally come out, because they could inherit the other part that is sickle, and to become what? They become sickle cell, and you might have more problems than love in the marriage. So we always counsel people against it. Don't let love just destroy your mind. No, I'm in love. Please go and check your genotype. Talk about love. When points are coming, the love will vanish. It will vanish. So please always get to check it. I don't know if I've answered your question anyways. I know I'm diverting, but have I answered your question?
Yes, sir.
All right. Me, I like talking. When I'm quiet, I don't know, my body is itching. All right. Esther number 2. Any question for clarification?
No, sir. No, sir.
Okay.
But sir, please, did you upload Tuesday's video?
I haven't yet. I will do that.
Oh, okay. Okay.
Okay. Fafa, any question?
Oh, please.
Okay. Rabina, any question?
No.
Hey. Faustina,
Me.
even if you have, I'll not even answer.
Hey.
Me, hey, I'll not even answer. All right. Emanuela.
Yes, no questions.
No questions. But how was the presentation? It seems today's the first time I'm seeing you here, right?
Yes.
How was the presentation?
It was okay.
So it's okay. It will help, yeah?
Yes, it's
Great. Great. All right. I'll come back to you later on. HP. The last time you were here, but I couldn't hear your voice. HP.
Taha, yeah.
Yeah. How was it?
Cool, sir.
Great. Great.
I don't have question.
Okay. Is it the same as Taha? Or Taha is different?
Yeah.
It's Taha. Okay.
Yeah, Taha.
Because it's your voice that you to know that this is Taha.
Okay.
You see me, I'm good with people. Joy. How was it? Any question?
Yes, Dr. Ba, 5 questions.
Good. Shoot.
Let's start with the one of eukinetic.
Okay. What is the question about eukinetic?
I don't know if my network was actually bad there. I didn't know the answer you picked for that particular question.
Oh, really? Sorry.
And
I'm coming. Let me just go to the question. Keep. Yep. So, just a second. Eukinetic. Good. So we said, when we say hypokinetic, please who can tell me what hypokinetic is? Oh, quick. Anybody?
Hypokinetic is for an increase in peripheral. Yeah.
Wow. See how people are rushing to answer. I love that. So it's for what? Peripheral resistance. So when we have peripheral resistance, we call it what? Hypokinetic. And then when we have increase in cardiac output, we call it what? Hyperkinetic. Now, if both are increased, that is both hypokinetic and hyperkinetic, we call it what? Eukinetic. And in this question, we are having both hypokinetic and hyperkinetic, isn't it? And that's why your answer should be eukinetic. Is it clear now?
Yes.
Awesome.
Okay, the next one is the one that had to do with the immune enzyme analysis.
Immune enzyme analysis.
Yeah.
Okay. That's about hepatitis also. Yes. What about it?
Yeah, that you said we used immune. You said you're explaining something about how to know that it's usually immune enzyme analysis.
Okay.
Because,
yeah. So I was saying that with immune enzyme analysis, we are trying to identify a specific antibody or a specific antigen. Specific antibody or a specific what? Antigen. So we use the immune enzyme what? Analysis. Okay. And you know hepatitis B usually is acute. Okay. And it's very, very dangerous if care is not taken. It can become chronic and your stomach can bloat. It can become big, called, ascites and that kind of stuff, isn't it? So you really want to analyze everything very quick and perhaps try to give some drugs to reduce. Don't forget, viruses have no cure, isn't it? But at least to reduce their troubles. So we use the immune enzyme analysis. And like I said, they use some specific enzymes to do that. And those specific enzymes are the peroxidases, the alkaline phosphatases, and even glucose oxidase. Glucose oxidase. These are specific enzymes they use to test the specific what? Antigen or specific what? Antibody. Okay. And again, this question is telling you that they want to know what? The reaction between what? The antigen with the antibody bound to these enzymes. bound to these enzymes. So this helps us to know the specific antigen or antibody. Antigen or antibody. I hope that makes, I'm making sense to you. Good.
Yeah.
Good.
Okay. The third one was when you talked about the hormone sensitive lipase.
Yes, lipase.
Sensitive triglyceride lipase.
Yes. So when we talk about have you asked yourself why people who are fat want to go on jogging? Exactly. They want to burn fat, isn't it? Yes. Now, when you begin to do activities, you begin to run, you begin to get stressed up and things like that, you are activating your hormone sensitive triglyceride lipase. And what does it do? It goes on to bring all those stored fat out. Guys, start burning, produce energy. Don't forget, we have beta oxidation. I don't want to go too much into biochemistry, but what we call the beta oxidation to produce energy. Please do it to search on them. I don't want to, confuse you guys today. What is called beta oxidation to produce energy? All of these, so if you are running, if you are stressed up, substances begin to be activated, and breaking down of substances begins to take place here and there. And we are saying that one of the things that these hormone sensitive lipase they use to activate other substances is the cyclic AMP. I believe you have heard of cyclic AMP before. Yes, it's called cyclic adenosine monophosphate. That's the full name. Cyclic AMP. This cyclic AMP will also go on to activate another thing again. So we have what to call primary messenger, secondary messenger, tertiary messenger. There's a question on those kind of things. When I get there, I will explain to you much better about, for example, hormones are primary messengers because it's the hormones that activate substances to start to start doing their activities, isn't it? So basically, that is what it is. And you see, even calciums, they are also secondary messengers in a way, because if, for instance, in where do I be? Maybe in cardiac, let's talk about coagulation, for instance. In coagulating cascade, at some point we use calcium. You might not know, but at some point we use calcium to activate the substances. So all of these things are there to help. The skeletal muscles and things, they use calcium, and this calcium is also coming from somewhere. So all of these things, they all help. But then in another question, another presentation, I will explain in details for you guys to know. But is that clear now? Cyclic AMP, is it clear now?
Yes.
Great.
Yes.
Awesome. Another one.
Then the last one on tromboplastin, that you said
Yes.
on tromboplastin.
Yes. I'm saying I don't know why they chose tromboplastin. That's what I'm saying. I don't know why they chose tromboplastin, because the reason is because tromboplastin is factor 3. Tromboplastin, when the deficiency of tromboplastin, it means there's factor 3 deficiency. Okay. But when the deficiency of factor 8, that's a different thing altogether. That's a coagulating factor altogether. That is going to disrupt the whole process. Do you understand me? That's why I'm saying that personally, in a way, I'm not convinced with the answer. But again, this is Krok. It could be correct, and I stand to be corrected as well. Okay. But that's what I'm saying. So unless, of course, you have contribution to add up, fine. But for what I know, this is factor 3 deficiency. Is it clear now?
Yes, whatever I have to add up, I'll send it to the group, because in part fee they talked about when they talk about the hemophilias, that's the factor 8
and factor 9.
End product is
tromboplastin.
Tromboplastin formation will be inhibited. Factor 9, which is hemophilia B. End product will be zombie. I really can't remember. But the last one now, that's factor 11.
Okay.
The end product that will be affected will be fibrinogen or fibrin.
Fantastic.
I'll post it if I see the exact file.
Please see it and then post it for us, okay? So that I want to get the explanation better. But I think that means in that case, this answer could be correct. In fact, it's correct.
Yes, please. Can you please explain the Cushing's syndrome and the
Okay, so this question goes to O2. O2, explain Cushing syndrome and Cushing disease.
Hello, please, can you hear me?
I can hear you.
Yeah, please. For the Cushing disease, you talked about the fact that it's caused by the pituitary gland, and then it has to do with the tumor in the brain.
Good.
But then when we talk about Cushing syndrome, it has to do with like the signs and symptoms of, I think, high production of cortisol. Level.
Thank you.
Yeah.
Thank you.
Yes.
Exactly. Eliada, are you clear now?
Yes, please. Thank you.
You're welcome. You're welcome. So next question. Sorry?
Please,
Yeah.
can that question be projected? Because like I didn't.
No problem.
really-
No problem. I'll project it for you. Okay, so Cushing. Good. So this was a question, and the question says that examination of a 42-year-old patient revealed a tumor of the adenohypophysis, and we've established that adenohypophysis also means the pituitary gland. Now, these objective findings are all what the signs and symptoms we are looking at for. But the question is that what is the diagnosis? And we are saying diagnosis is Cushing disease, because in Cushing disease, we normally have what? A tumor of the pituitary gland. In Cushing syndrome, these are simply signs and symptoms of excess cortisol or high cortisol. Does it make sense now?
Yes, please.
Good. Good. All right. So next question. Ben, any question?
No, sir.
All right. Good. You know, if you say no, sir, and somebody asks a question, it's coming to you. Okay.
Yes, boss.
Good. Good. Esther, number 1.
Yes, sir. No, I don't have a question. Sir.
Okay. That means you're ready to answer a question then. Good. Yimano. Yima.
So I'm with you.
Good. Any question?
No, sir.
Okay. Also ready to answer another question. I have teachers today. Today I have a lot of. Please, someone should ask me a question now. Fafa.
Yes, please.
Sorry?
Please, I have a question. Can you hear me?
I can hear you.
Okay, about the thiazide. That question, I don't
The
know the question
thiazide.
number, but can you please project it?
The what?
About the question about the diuretic. I don't know the question number, but
Okay.
I think it was talking about spironolactone or something.
This one?
yeah. Yes, please. Please,
So-
my question is that
Uh-huh.
they were like, despite the administration of cardiotonics and thiazide, like
Yeah.
hydrothiazide, hydrochlorothiazide, and everything. So the person has a chronic heart failure and persistent illness and risk of eyesight, blah, blah, blah.
Yeah.
And what medication should be administered to enhance the diuretic effects of the administered drug?
Yeah.
I was thinking it should be furosemide. I want
Furosemide
to understand why it was. Yeah,
Good.
because furosemide is like a loop diuretic.
Yeah.
So I wanted to understand why we chose spironolactone.
Okay, good. Very good. So this one I'll answer it myself. Now, we know in furosemide, one thing you can see is that there will be excretion of potassium. True or false?
That's true.
It's true, right? Now, don't forget, already they've given this person thiazide, which all of them, in a nutshell, thiazide are also secreting potassium out. Hope you know that.
Yeah.
Exactly. So now we're already giving thiazide. Now, if you want to go and add furosemide again to it, you are going to cause arrhythmia development in the patient. And don't forget, the person is already having what? A heart failure. And now you're going to cause arrhythmia because, don't forget, I said potassium deals with what? Arrhythmias. So now, if you're going to decrease the potassium concentration in the heart, it's going to cause more harm than good. So yes, we are going to use the spironolactone because we want to still take more fluid out, but we want to still maintain the potassium concentration in the body because we stand a risk of losing the person if we allow more potassium to go out. So to enhance the diuretic effect of the drugs that have already been administered, we use the potassium sparing. Does it make sense?
Okay, yeah, now it does.
Furosemide is a false diuretic. It will cause everything to pum, which
Yeah, I was thinking
dangerous.
because it's used for forced diuresis and the person has these persistent edema.
Good. Even
so I was thinking
it will use it when the person has not already been given a diuretic yet. Okay. But if it has already been given a thiazide already, please, you will cause more harm by giving the furosemide. All right. And I think it's O2. You asked a question like that before.
Yes, please, I did.
Yes.
Yeah.
And I think I I explained to you better, right? I mean, you got the places. Yes.
Yes.
And even that one, the answer was furosemide, if I'm correct.
Yeah, but
exactly.
You were talking about this spironolactone.
Exactly. Good.
Yeah.
Good. All right.
And
So
please,
that
the next question,
yes.
the next slide after this too. I didn't really understand.
The next
slide
line.
after this question. The next slide after this question.
This one?
Yeah. Yes, please.
Good. So technically, we are having a patient who has already died, but we want to look at what caused his death. So we'll do an autopsy. Okay. Autopsy. But before that, they said the person died with hemorrhage. That means bleeding. Now, autopsy is showing that the liver was big. Sorry, the kidney was enlarged. It has a pale pink cortical layer. Demarcated, that means separated from a dark red renal pyramid. And again, that could also be because of the hemorrhage. Because you're hemorrhaging, that means that some part of your tissues will not be getting enough blood because you are bleeding. So necrosis begin to ensue. True or false?
True.
Exactly. Now, macroscopically, that means macro. It's not micro, macro. It is showing that we are having epithelial nuclei of convoluted tubules. Don't forget that the nephrons are made up of what? The proximal convoluted tubule, the distal convoluted tubule, the loop of Henle, the collecting duct. These are what? The tubes. Okay. Now they are telling us macroscopically that there is what? An epithelial nuclei of, there is lack of epithelial nuclei of the convoluted tubules. There is tuberorhexis. There is phlebistasis. All of these description is describing the tubes. All of these are describing the tubes. And we are saying, what pathology are we looking at for? Definitely, we are going to consider what? We are going to consider a problem with the tubules, not the glomerular apparatus, not the glomeruli, not the pyramids, not the calyces. Our concentration is with the tubules because these are things that we can even see macroscopically. And by virtue of that, we say we are having an acute tuberous necrosis. Acute tuberous necrosis. And another name for acute tuber necrosis is what? Nephrosis. Am I making myself clear?
Yes, please.
So are we okay now?
Yes, please. Thank you so
Awesome.
much.
Awesome. Awesome, doctor. Awesome. Awesome. All right. So we move to who again? Okay. That was Eliada, right? Oh, that was Fafa.
It was
Uh-huh.
And
So,
please, can you please
yeah.
repeat the other name for necronephrosis?
Necronephrosis is acute tuberous necrosis. Acute tuber necrosis or tuberous necrosis. Acute tuber necrosis. Are you okay now? Good. All right. So I'll move to Esther number 2. Any question, Esther? Esther, are you here?
Said no.
Uh-huh. I thought you have left me for another boyfriend. I was about to
No.
divorce you too. Okay. Rabina, any question? Rabina, any question?
Dr. Ba, please no.
What took you long? Was he holding you?
No.
He wasn't holding you. Okay. Faustina.
Sebaha.
Madam Faustina.
Please, I have a question.
Please shoot.
Yeah, the question about the protamine sulfate and the Vicasol.
Yes.
Yeah, for me, I was thinking the answer could also be Vicasol since the person is bleeding and we need something to stop the bleeding. And Vicasol 2 is a vitamin K derivative. So I was thinking maybe we could use Vicasol 2. So why is the answer protamine sulfate?
Now, the thing is not about the fact that we want to stop the bleeding, but the thing of the fact that one drug, 8 overdose is causing the bleeding. So we want to antagonize that drug. Do you get what I'm saying? So I'm coming. Oh, why am I having my typing safe? Good. Now we are having a. Can you guys see it on the screen? You can see, right?
Yeah.
Good. This person was given heparin. The person was given heparin to prevent what coagulation, because people with myocardial infarction and you have somebody who having coagulation, it can easily lead to other conditions that you don't want to have. So people was given what heparin. Okay. Now this heparin, after they say what? Sometime after, the heparin injection now developed what? Hematuria. That means that 8 overdose is now causing the complication of bleeding. I understand what I'm saying. So now the main idea is that if we control the heparin, the bleeding will stop. So we have to look for an antagonist to heparin. Am I making myself clear? But on a normal day, in case you are bleeding, yes, we can go for it. But this one, a drug was already introduced, so we're trying to antagonize the drug so that the person can be relieved. So now you understand it, right?
Oh, so it wasn't about the hematuria, just to antagonize the heparin.
The question is, what heparin antagonist?
Oh, all right.
What heparin? The question is what? The question is not what coagulant should be given. Question is, what heparin antagonist should be injected to remove the complication?
Okay.
Prayatna?
Tak.
Tak. Good. All right. So we move to Joy.
Dr. Baha,
Yes, talk to me.
no question.
No question. Okay. I hope you are doing my hair for me, or you're planning on my hair this thing for me. Me, I'll keep messaging you. Don't mind me, but please, when my hair is ready, start growing now. You're going to do it for me. Yeah, I'm bringing some people look very nice.
Oh,
It's not fair.
thank you.
It's not
Don't worry,
fair.
I'll do yours for you.
Okay.
No.
Hey, who is saying no? Hey, Rabina. Hey. Now the hatred has gone to that level. Okay. Ahmed. Any question, Ahmed? Ahmed. Okay. Taha.
Yes, sir. You hear me?
Yeah, Ahmed. I can hear you. Do you have any questions? Yeah.
I was using the headphones, so maybe they are not working. Yeah, I have. It could be a question, but about the question of the renal diabetes and glycosuria. We choose like the decreased activity of glucose reabsorption enzymes.
Yeah.
Why did we choose the filtration, increased glucose filtration? Oh, so
this is the question, right?
Yeah. So
yeah,
when the glucose filtration increase, means that glucose will be more. Yeah.
Yes. Very good. Very wonderful question. Now, good. So now, the question is this. The question is that according to the result of glucose tolerance test, a patient has no disorder of carbohydrate.
Yes.
I mean, carbohydrate tolerance. Okay. Now, despite the fact that the person is having no disorder of glucose tolerance, glucose is still detected in the patient's urine.
Okay.
So we diagnose the person of renal diabetes. Now, in renal diabetes, the problem is not really about glucose filtration, but the problem is that because filtration, it will go, all right. But the problem is that when the glucose is filtered, which normally, glucose is normally filtered in the converter tube, it is filtered, but it must be reabsorbed. Guys, are you understanding me? Glucose should be filtered, but it must be reabsorbed into the vessels again. And there's a problem with that reabsorption in cases of renal diabetes. And that's why this glucosuria, we can say it is caused by a decreased activity of the glucose reabsorption enzyme. Because, of course, for the first one, glucose must be filtered. No problem about that. But when it is filtered, it must be reabsorbed.
So renal diabetes means increased glucose level, and glucosuria means increased glucose level in urine, yeah?
Yes.
So the glucose level is increased in the kidney and in the urine, both of them.
No, don't forget that when we say renal diabetes, I don't know how to describe it, but even when you are having normal diabetes, okay, sometimes you can see glucose in the urine because there's too much glucose in your body that it can be excreted, and sometimes you can see it inside your urine. But that is not described as a renal diabetes. Now, in renal diabetes, the problem or the glucose that we are thinking about is as a result of the kidney. Do you understand? It's as a result of the kidney. So because glucose is not being reabsorbed, the kidney excretes it as urine.
Okay.
Ahmed, do you get it now?
Yeah.
It makes sense now, right?
Yes.
So the glucose is not reabsorbed. So we call it renal diabetes. Just like in blood, when your glucose is not reabsorbed into the tissues, we call it diabetes.
If this sentence is not written, the patient has renal diabetes, and the question is only what renal changes cause glycosuria. We can't choose like increased glucose filtration.
Yes.
Okay.
Yes. Now,
thank you.
It makes sense, right? right?
Yeah.
Good. All right. Okay, so who comes in again? Yes, Taha.
Yes, sir. Doctor.
Yes. Any question? Yeah.
Question, yeah. Question was absence of immunoglobulin of any type. Any type.
Come again?
Absence of immunoglobulin of any type.
Absence of immunoglobulin. Okay. The Brutons, right?
Yeah.
Hey.
Hypo.
Okay, I'm coming. Brutons. Yes. So what's the question? Now the question is, there's absence of immunoglobulins of any type. And we are saying that immunoglobulins are produced by B cells.
Yeah.
B cells. And whenever we are having this kind of thing, the name of it's an autoimmune, how do you call it? Problem. Okay. Or it's a hereditary problem, put that way. It's a hereditary what? Problem. And anytime we are having absence of this, usually we're talking about what? The Bruton agamaglobulinemia. That's what we look at for. There's another one that will be thinking of what? The T cells. That's why I said I will come to them later on when we get to those kind of questions. Is it clear now?
Yeah.
Good. Any other question?
No.
Good.
No. Thank you, sir.
All right. Welcome. But please, Ahmed, and try and get the website, okay? Because there are a lot of information there. Dr. Tolu, any question?
No, sir.
Okay. All right. Who again? Zoom user. Any question?
Sir, can you hear me?
I can hear you.
So please, the
What's your
is
name?
Is it for only Android users?
Sorry, the website or the app?
The app.
The app, unfortunately, is for Android users. But on the 15th of March this month, I will have the web version of it.
So meaning the iOS people, we can use it. Oh.
Yes, you can use the web one.
Okay. Thank you.
What's your name?
So my name is
Lean.
Yes.
Lean. Okay. No problem. And you have to use Zoom user. Okay. Try and message me after here, okay?
Okay.
You have my number, right?
Yes.
No, you have.
Yeah.
Hey, and you are hiding yourself from me. It's not fair. You don't need to add it to my wife's, isn't it? Okay. You're saying, If you're my enemy here, you may happy.
How many do you have? Let one for us.
Ahmed, mind your business. Ahmed, mind your business. Leave me alone. Did I tell you that I can't handle them? Did I tell you? Did I tell you I can't handle them? Did I tell you?
Okay.
Go and ask her to the way she has been happy, smiling all the time. Go and ask her. Mirabel.
Yes, I do have a question.
Sorry?
Yes, I do have a question.
Sure. But how was the presentation? Is it something that is good for you? It's your first time, so I want to know what you think about it. Okay.
Yes, please.
Okay. And what's your question? Yeah.
Back to the furosemide question.
Yes.
No, not the furosemide question. The question we had to choose protamine sulfate, not
yes.
all. I understand the explanation that it was because of because we are antagonizing heparin.
Yes.
But can Bicazole also be an antagonist of heparin? Because I've seen a question like that before. And in that question, there wasn't protamine sulfate.
So the question is, can Bicazole also be an antagonist?
Yes, the question was like, what is an antagonist of heparin? But there wasn't protamine sulfate in the option.
There was
Bicazole.
Good. You do know Vicazole is a vitamin K, right?
Yes.
Am I right?
Yes.
Good. So vitamin K also has its own sort of what uses as a way of how do you call it? Should I say coagulation ability? Okay. And sometimes, just like you said, in the absence of maybe protamine, which of course we can also use what the Vicazole as a way of what how do you call it? But that one will not really say it is antagonizing heparin per se, but then it's helping in coagulation. Do you understand me? So yes, in such cases we can, but when we have the protamine sulfate, where is the direct antagonist for heparin, why do we want to go for the vitamin K analog, if I should put it that way? Do you understand me? So yes, in case where it is not there, fine, we can go ahead and then usually, because don't forget that medicine is not whole in its entirety. Do you understand me? It's not a whole something. Sometimes we have to look at the option that we have, then we choose the most likely answer. Doc, do you get me now?
Yes, please.
So yes, we can consider it as an option. Definitely, we can. And I think that's why one of us was also thinking about the Vicazole as an option. But then we have protamine, so we'll definitely go for the protamine as the likely answer. Is it good? Are you okay now?
Yes, I'm fine.
Good.
Thank you.
You are welcome. You are welcome. You are welcome. Please, I guess I've spoken to everyone here. Spoken to everyone.
Hello.
Yeah, Tolu.
Yeah, I have a question.
Sure.
Please,
I
could you
called you,
explain?
didn't answer, right?
Yeah, I just no,
Okay.
I did answer. I just remember the question.
Okay, sure. Shoot.
Could you explain further about the macrophages of the alveolar type 1, alveolar type 2, and alveocyte macrophages?
Okay. So okay, now we are saying that there is a bacterial invasion. There's a bacterial invasion in a surfactant. They say it interacted with the surfactant. And it just dawned on me what so I want to ask to know what the surfactant is all about. You know when a child is born, okay? When a child is born, one of the things that helps the child to actually breathe or have his or her first lung respiration is because of the surfactant. And sometimes when a child is being born prematurely, we have to give the person the Vicazole so that the person can be able to develop surfactant very quickly, so the person can be able to breathe. So, but that's just by the way. But what I'm saying is that surfactant, we have two types. We have type 1 and then the type 2. The problem here is not about the surfactant, but I just chipped it in. Okay. We have the type 1, type 2. One is involved in the cell wall of the alveolocyte, and the other one is involved in the exchange of gases itself. And that's an assignment that I've given to you guys. Find out the difference between the type 1 and the type 2. I'm giving you as an assignment because I've already said it before. So it's an assignment for you guys. But the question now here is that these tissues have been invaded by a bacteria, which is an antigen. Okay. So, in what way does the body fight against bacteria? The body fights against bacteria by undergoing what? Phagocytosis. Again, I explained this in our last presentation, if I'm correct. I even drew a diagram that inside the cell, inside the blood vessel, we have the monocyte, we have the lymphocyte, we have the white blood cells, we have the platelet, we have the RBCs and co. But anytime the body senses that there is a tissue damage by a bacteria or any organism or antigen in general, monocytes, which are in the blood vessels, will begin to enter into the tissue where the problem is. But when they enter into the tissue, they are no more called monocytes. They are now called macrophages. So they will now attack the cell, engulf it, and undergo phagocytosis. However, when the macrophages are overwhelmed by the number of bacteria that is present, I mean, you can't work alone. That is when it begins to call the neighboring cells, like the WBC, neutrophil to be specific, cause the cytokines to all come to play to fight against what? The antigens that are present. But the question here is that what led? They said this led to the activation of the cells that are localized in the alveolar walls and on the surface. Name these cells. So yes, though they're talking about the alveolar wall, but inside the alveolar wall, which could be either type 1 or type 2 surfactants, these alveolar macrophages are there to engulf the bacteria, to kill the bacteria, to make the bacteria what? Free. Please, am I making myself clear?
Yes, sir.
Awesome. So now you are okay.
Yes, thank you very much.
You are welcome, Tolu. You are welcome. You are welcome.
Yeah, I do.
Sorry, you have a question?
Yeah.
Please shoot.
In shock.
Shoot. Okay, shock. So we said in shock. Okay, so what's the question in shock? You are confused or the explanation? Let me go back to it.
Yeah.
Which is which? Confused or the explanation, or you have something
I didn't
to
get
add?
explanation why.
Okay.
And
Okay. Keep. All right. So, just a second. Okay. So we talk about stages of shock. Now, we said in stages of shock, we have the erectile stage, then we have the tepid stage. And we said under erectile stage, just like the name signifies, the guys can relate more. Erection, right? In fact, everybody knows erection, isn't it? Erection means you are kind of excited, isn't it? So excitation, your central nervous system is excited because somebody is touching you. Somebody is touching Ben. So Ben is getting excited, isn't it? So it happens.
Oh, wow.
So the person get excited. So just understand it that way. So when we are having accident, initially you get so excited, not that you get happy in that context, no. But I'm just going to correlate so you can get the explanation right. So at the beginning of the shock as a result of trauma, so as a result of accident, road traffic accident, your central nervous system begin to be excited. They get activated and things like that. So that can be classified as an erectile stage. Then as time goes on, just like when everything comes out, you know what I mean? Everything comes out. When erection is over, it dies down. Why will it die down? It died down because now there's no excitation anymore. Why? Because now it's over. It's over. 5 minutes is over. The 5 minutes pleasure is over, isn't it? So when it's over like that, you go back to what? Your normal state. Even below normal state, isn't it? Nothing will even make you erected again. And that stage is the tepid stage, whereby there's now oppression of the central nervous system. Are you getting me, Dr. Fafa?
yeah.
Do you get it now?
Hello.
Yeah.
Yeah, you said there's going to be an oppression of the central nervous system.
Yes, oppression. That's more or less like now the good. Now let me just come in with this one. So for example, now the reason why there is too much of blood pressure is because you are trying to make sure you can compensate for everything, isn't it? For the loss of blood, because in trauma, you're going to lose blood. So at the beginning, you will try. So that's why your central nervous system get excited. So it can start working to compensate, move blood to this tissue, move blood to that tissue. But when the bleeding continues for a longer time, that means there will now be what? Ischemia in the brain. And when there's ischemia in the brain, it can lead to what? Stroke. And stroke simply means inadequate supply of blood to the brain cells. That means there's oppression, there's shrinking. Now, the body can no longer function as it's used to function. So that is the tepid stage. The tepid stage. The tepid stage. Please, does it make sense now?
Yeah,
All right. Great.
And please, the question on the two Iliac Crest, when you were saying the values, my network was breaking, so I didn't get it. Could you please?
So talking about the iliac crest, we said the distance between the two iliac crests is about 28 centimeters. The distance between the trochanter, you know trochanter, right? I mean, if get anatomy, you will know what a trochanter is. They are all part of your pelvic area and things like that. It's about 30 to 31 centimeters. This conjugatal varus is like 2 centimeters, if I'm correct, because you subtract 9 from 11, something like that. So nothing to really talk about. Basically, these are the few things you need to know if that's what you're asking for. Is that okay?
Okay, yeah.
Good. All right. Okay. So we move to Taha. Taha, shoot your question. Taha, can you hear me?
Yeah, I hear you. Go.
Yeah. Any question?
Question. The answer to this question was Ascaris.
What?
Ascaris.
Ascaris?
Yeah. Ascaris.
Ascaris.
Yeah.
Ascaris lumbricoides. Okay. Now we are saying that the diagnostic feature for us to say that this is ascariasis is the infiltration of eosinophilia, or this eosinophilic infiltration. This is the reason we are saying that this is ascariasis. And I'm saying that in some books, they might not use eosinophilic infiltration. They will use Loeffler's syndrome. Loeffler's syndrome. Are you okay now, Taha?
Yeah.
Good.
Thank you so much.
Good. Welcome. Ahmed, shoot your question.
No question, Doc. Thank you.
No question. Okay, no problem. Let's move to Joy. You give me joy. Yes, Joy. Shoot.
No question, but I would like you to talk about that interferon.
Okay, so interferon mainly is let me say, just like we have antibiotics, we have what to call interferons. Okay, so it is used to treat diseases. Are you getting me? It is used to treat diseases, especially of viral origin. Just like we have antiviral agents. So antiviral agents, most of them come from interferons.
Okay.
Are you getting me now?
Yes.
Great. All right, Mirabel.
Please, I don't have any question.
Wow, please, I don't have any question. Okay, I've heard you, Mirabel. All right, so let's move to Mohammed Hussein. I think the first time I'm meeting you, Mohammed. So how is the presentation? First of all, how do you see the presentation? Is it okay for you? Mohammed Hussein. Okay. Mohammed can hear me. In my group, we all talk, okay? All right, so I'll go. Yeah, you can hear me now? Mohammed? I think.
Yes, look right.
Good. How is the presentation? How is it? Is it good? Will it help you? Oh, I didn't get your response. Okay. All right. Okay. So I moved to Tolu. Dr. Tolu?
Yes, sir.
Any question?
No, thank you.
Okay,
Very much.
no problem. Faustina, any question?
Sebaha.
Yes.
No, not really. But please, the question that you chose, chronic abscess.
Yes,
Can we
yes.
the question? In which case do we choose
Acute.
In which case do we choose empyema?
Good. So we have a patient has undergone a surgical removal of, now there's a cavity, there's more or less like a cavity, isn't it? Because they say there's what? A cavitary liver lesions, 2 centimeters in diameter. Okay. And it was revealed that this cavity wall was formed. It was formed by a dense fibrous connective tissue. Now, anytime you're having this dense connective tissue being formed, it's usually a chronic sort of condition. So just take note. Just like scarring of the liver, scarring of the heart, scarring of the lungs, you are thinking of a chronic condition. Now, and they are saying that the cavity contains what? This yellowish green fluid, unpleasant, whatever odor, isn't it? And we are having a polymorphonuclear what? Leukocyte. Now, these are telling you that there is the presence of what? Infection. Presence of what? Infection. And of course, that can only be what? Of course, an abscess formation because of the cavity being formed. This is what? An abscess formation. Now, in empyema are formed within the pleural space. Are you getting me, Dr. Faustina? Empyema are formed within the inner surface of the chest wall, which is the pleural space. The pleural space. That is where empyema are commonly formed. But of course, it's also what? An infection. And usually, they can also come from pneumonia infection. And you know, in pneumonia, people can easily get what? A pleural effusion and things like that. So that's where empyema. So pus formation in the pleural cavity is called empyema. Okay. So don't confuse the two. All right. So I believe your question is clear now.
Yes, sir.
And acute and chronic, you know the meaning now. You understand
yes,
it now. Please. All right. Fantastic.
Say, what about the phlegmon? Can you please elaborate about that?
So a phlegmon is also some sort of what? A widespread kind of what? Infection. So in phlegmon, we can more or less call it, it's a form of what? Sepsis. You know, in sepsis, it's a kind of a systemic kind of what? Infection. It is spreading. That's more or less like a phlegmon. Spreading. Do you understand? But of course, it's also a form of what? Infection. But that one is more of a spread. But this one is focal. It is focal in a cavity inside the tissue, inside this place. But in phlegmon, it will be spreading. Is it clear now?
Yes, sir. Thank you.
Awesome.
So I have a question.
Sure. Shoot. I want question.
That one of IgM that you talked about.
Yes.
Can't we pick the option to be anaphylactic? Not, I've forgotten the answer for the other one.
Recent infection or recent.
Yeah, not recent infection.
Okay, let me look at the question. Let's look at the question together. Keep this. So answer was what? What was the answer again?
I've forgotten the answer for the option.
About IgM. Okay, IgM.
Yeah, we talked about IgM.
You don't have a problem if, by the grace of God.
Yeah, recent infection.
Good. So we said what? Look at it. A pregnant woman was detected with IgM, 2 rubella infection. Now they want to abort the baby because actually we don't allow patients who are pregnant to, pregnant and having rubella virus. Mute the microphone here so that I'll explain because it's coming in. Good. So we have what the IgM, the rubella virus. And so rubella virus, if you are pregnant, we don't even consider you. We have to terminate the baby. Otherwise, the baby will come up with malformations and things like that. And these are called what? Teratogenic effect. They say detection of IgM was of great importance. Why? Now you were talking about what associated with. Now when we talk about anaphylactic reaction, anaphylactic reaction is more or less like type 1 hypersensitivity. That is anaphylactic reaction. So you could be seeing of rashes, you could be seeing of itchiness, you could be seeing of in bad cases, you could be seeing of hypotension. That is shock developing. Okay. And things like that. So these are for what? Anaphylactic reaction. Anaphylactic, you will see cardiovascular compromise. Cardiovascular compromise. But that is not the case in this question. And that is why over here, our best answer will still be what? Infection. Now, infection doesn't mean anaphylaxis. Am I okay now, Dr. Yima? Does it make sense?
Yes, sir.
Great. All right. So, Fafa, shoot.
No, please, I don't.
You are fine. Okay. God bless.
Yeah. So please, when
Yes.
you were talking about the white adipose and brown adipose,
Yes.
you said the white adipose was you said you in something. I didn't hear you well.
Okay, so we said one of the difference between the white and then the brown is that in a white adipose tissue, it is found in adult. The brown is found in the fetus. I mean, in children. I mean, unborn babies, basically, or in people who just give birth. And again, with the white adipose, the nucleus is small and it is not in the center. It is moving to the sides of the cell. So the edges, so we call it the periphery around the cell. That's where the nucleus is found. In brown, the nucleus is big and it is found in the center. Do you get the differences now?
Okay.
Good.
Okay. Thank you.
You're welcome. So brown, let me just bring it out. Good. So over here, you said that the nucleus is compressed. That means it is quite small and found in the periphery. So in the question, they said the nucleus is found in the center and it is big. Please, your answer is what? Is brown. Your answer will be brown. But in this case, our answer will be white. All right. So Mirabel.
I don't have any questions.
All right. Great. Taha.
Yeah, doctor.
Yes, any question? Sure. Ask.
Okay, so the answer of this question was furnicle.
Was what?
Furnicle.
Was what?
Furnicle.
Furuncle. Okay. Furuncle. Okay. Great. So this question goes to, where is Irabina? Irabina has disappeared. Okay, so this question goes to Otu. So Otu, why is the answer furuncle? Let's go.
Hello.
Yes, I can hear you. We can hear you.
Please come again. What did you say?
Why is the answer furuncle? Someone is lost. Why is it furuncle?
Oh, okay. So I think for the furuncle, you talked about the fact that it has to do with if it's like those with diabetes normally have like presence of boils. So if it's just a single boil, it's furuncle. But if it's multiple boils, that's carbuncle. Yeah.
Wonderful. So doctor, just like Shirley said, people with diabetes high are having high risks of developing boil. Boil are like some swellings on the body. Okay, that contains pus formation. Or pus formation. Okay, so that is what a boil. And we said a single boil is called, how do you call it? A furuncle. Whilst too many boils, we call it a carbuncle. Does it make sense now?
Okay, sir. Okay.
Good.
Thank you.
Good. All right. Fantastic.
About atrial hypertension, what are the questions like? Like, I don't understand that.
When we talk about atrial hypertension, for example, when we start talking about cases of stroke, we have stroke and we have shock. Now, hypertension is a risk factor for the development of a stroke. Why? Because of too much pressure in the brain, and that can lead to a problem. And hypertension can even cause what we call AFib. And we'll have atrial fibrillation. Again, it can lead to clotting. And when it causes clotting, it can also prevent flow of blood to the tissues in the head. I mean, in the brain, let me put it that way. Is that clear now?
Yes, sir. So what of for the venous hypertension?
When we talk about venous hypertension, we are talking about the portal hypertension. Portal, that can lead to what we call the ascites, the liver cirrhosis or liver congestion, and all those kind of stuff. Because it is the portal hypertension. That is where they normally accumulate. Do you understand? So when somebody's having an abdominal pregnancy, I mean, having a guy is pregnant, know that this guy could be having a problem with the portal system. Is that okay?
Yes, sir. Thank you.
Great. All right. Rabina, shoot. Oh, okay. I guess she's working. Fafa?
Yes, please.
Sorry?
Please, can we go back to the first question?
The first question, sure. This is the question. So,
yeah, please, you said the answer was temporal. Okay.
Temporal.
Mm-hmm.
Temporal.
But you said when it's partial summation, there is a simultaneous stimulation.
So, in all of them,
repeated.
Good. So in any of the summations, okay, we have two types mainly: the spatial and then the temporal summation. In any one of them, there's combined effect of individual reflexes. I mean, individual stimulation, put that way, individual stimulations. So combined effect gives us the reflex action. Is that one clear? Combined effect gives us the reflex action. It's just like taking the triple therapy for people suffering from peptic ulcer. We give them proton pump inhibitors like the omeprazole or ranitidine. We can give them amoxiclav, which is more or less which is an antibiotic. Then we can give metronidazole as well for this patient. This is a triple action. I mean, a triple therapy. And all of them is coming to solve a problem. Sorry. So all of them is coming to have a single effect or to potentiate the effect. Is that one clear? Oh, I want to be hearing you. Did I, Fafa?
Yeah, sorry. Yeah, I can hear you.
Good. So if you understood that the same mechanism, let's import it over here. So now we're saying that anytime there is two or more, stimulation that is causing an effect or an action to happen, we call them what? Summation. And we're saying that in the summation, we can talk about the temporal one, we can talk about the spatial summation. Okay. And when we talk about spatial, we're talking about multiple. We are referring to multiple simultaneous input, multiple spontaneous input. So we don't care whether it is an excitatory signal or stimulus or an inhibitory signal. So for us, they are all happening at the same time, causing the effect. We call of them what? More or multiple impulses. We call them what? Spatial submission. Spatial submission. And we are saying that when it comes to dealing with the temporal one, it doesn't involve a lot of impulses. It doesn't involve a lot of impulse. And we are saying that in question whereby they might be referring to the spatial summations, they will give us more clues to help us that this we are dealing with a spatial, a spatial summation. Is that clear now, Dr. Fafa?
Yes, please. Thank you.
All right. So we move to Faustina.
Yeah, Sabaha, please. The first question is still this one. Because when I checked from Google, it's like all of them, they involve some kind of repeated stimuli.
Yes.
Yeah, so I think we should really
look
differentiate
at it
between the two.
Okay.
But it's
so,
they are still similar.
Kind of. That's what I'm saying, that if you look at the question, everything is more or less the same. But one of the things that can help us, that's why someone asked at the beginning, one of the things that can help us to differentiate is that in the cases of spatial, Krok will help us. But don't forget that Krok in itself, somehow, they defect in some of their question formation. Hope you know that. So put that at the back of your mind. So then the questions are not too clear. But always at the time, we also have to put explanations to them regardless.